The second oral surgery procedure that we're going to demonstrate is a complicated extraction. The tooth that we're going to extract is the 4-8. Again, we're going to assume that the dental assistant has placed the topical anesthetic in the appropriate place for the dentist to freeze the appropriate nerves. The dentist is now going to take the syringe that has been put together with a long needle that the dental assistant got ready. While the dentist gives anesthetic, the dental assistant again gets ready to give a courtesy rinse. Once the courtesy rinse has been given, we assume that about 10 minutes has passed, and we pass the Mirin Explorer to the dentist to check for freezing. Make sure that the patient is sufficiently numb. After the patient is sufficiently numb, we will again pass to our dentist the instruments that are required. The first instrument that is required is the scalpel. Because the scalpel is a very sharp instrument, we're actually not going to pass it. It's going to be put together and placed to the side for the dentist to take on their own. The dental assistant will then take the Mirin Explorer from the dentist. The dentist may prefer to use what's called the Minnesota retractor. The Minnesota retractor is used to retract tissues. While the dentist is using the scalpel, the dental assistant will always suction throughout the procedure. In this particular procedure on Dexter, we need to pretend that this very last tooth, the 4-8, is tissue covered. So we have to use our imagination for learning purposes at Columbia College. So what the dentist is doing with the scalpel is actually cutting or incising the tissue so that they can flap it open and get to the tooth for the extraction. We're actually just pretending with all of this. We do not actually cut the tissues on our mannequins. So after the dentist has cut the tissue, the dental assistant is going to pass to the dentist the periosteal elevator. The dentist will then take the periosteal elevator and pull away all of the tissues. The dental assistant continues to suction throughout the entire procedure. After the periosteal elevator has been completed, what the dentist is going to do is take the slow speed handpiece that has been prepared with a surgical length round burr. At this point, the dentist is going to use the round burr to remove any bone. The dental assistant will use sterile water in the Monoject syringe. We will not use water out of our tri-syringe that could be contaminated. So as the dentist is drilling away the excess bone to get to the tooth, the dental assistant is suctioning and squirting water via the Monoject syringe. Once the tooth is visible that the bone has been removed, and again, we have to use our imagination here, the dental assistant is then going to pass to the dentist the straight elevator. With the tooth elevator, the dentist is going to attempt to remove this tooth. After the dentist has elevated the tooth with the straight elevator, the dental assistant is going to pass the appropriate forceps. The forceps that we're going to pass our dentist are the lower forceps. The dentist is then going to attempt to remove this tooth. The tooth removal is unsuccessful. Therefore, the dentist needs to take the high-speed handpiece with the surgical length Fisher burr. The water is turned off of this high-speed handpiece because we again want to irrigate with our Monoject syringe with sterile water. At this point, the dentist is going to section the tooth. What sectioning the tooth means is cutting the tooth in half so that the dentist separates or splits the roots and takes half the tooth out at a time. The dental assistant continues to irrigate with the Monoject syringe with sterile water. Once the tooth has been cut in half or sectioned, again, we are going to transfer the tooth elevator to our dentist to loosen the tooth from the socket. We are then going to transfer the forceps once more to our dentist. The dentist is going to remove half of the tooth at a time. The dental assistant has a 2x2 ready to take the pieces of the tooth. And we're going to take the forceps and the tooth all at once. We're going to assume for our learning purposes that when this dentist removed the tooth, one of the root tips broke off down into the socket. So at this time, the dental assistant will pass to the dentist the root tip elevator. So with our root tip pick or our root elevator, our dentist is going to go down into the socket and attempt to remove this broken off root fragment from the socket. After that has been completed, we now have to take care of the actual socket. The dental assistant will then pass to the dentist the rongeurs. What the rongeurs do is they trim the bone and smooth it so that the socket can heal properly. The dental assistant again will have a 2x2 ready to remove any little bone fragments as the dentist is working. And then actual transfer of the rongeurs back. The dental assistant will then pass the bone file. The bone file is used to smooth off the different parts of the socket. Followed by the curette. Again, we need to remove any debris from the socket, any abscess, any infected tissues. Notice the dental assistant continues to suction throughout the entire procedure. Once the curette has been used, the dentist will irrigate the socket with sterile water through the Monoject syringe. After the socket has been completely cleaned out, irrigated with sterile water, the dental assistant will pass to the dentist what's called gel foam. This foam acts as a clotting agent. It helps for the blood to clot. So they will pack this little foam down into the socket and it actually stays there. It's never removed. It will dissolve into the socket, and with the blood clot, it will just dissolve and become a part of the tissue, and the tissue will start to heal. After this has been placed, we now need to suture the socket. Now, for our learning purposes at Columbia College, we do not actually place a suture. We will hand either needle drivers or hemostats, and we will pretend to suture up this socket. We don't actually have a needle and sutures that we will actually suture. We, again, just use this as pretend. So once the dentist has sutured our socket, the dental assistant will pass the dentist the scissors, and the dentist will cut this little suture and cut it off so that it's stable in the mouth. After they have cut that, we're going to provide a courtesy rinse for our patient. When we put in our moistened 2x2, we are going to be using sterile water again just to moisten and place this over top and have the patient bite. We would then return our patient to the upright position, and we would give our patient proper post-operative instructions.